Good morning, everybody. My name is Pontier Juno. Today, we will learn about staging system and prognostic factor of soft tissue sarcoma. This is the first slide for the background. So, the background is staging in soft tissue sarcoma is different from staging in other tumors. So, that survival rates of soft tissue sarcoma is still low, and we must recognize several prognostic factors that make this happen. So, this is the outline. The first of all is what is soft tissue sarcoma. Second is what is the staging system and what is the difference. And the third, what is the prognostic factor of soft tissue sarcoma and why it is so very important. Now, the first one is sarcoma. Sarcoma is a group of solid tumor of mesenchymal cell origin that have very distinct clinical and pathologic features. Now, we divide the sarcoma into two different kinds. The first one is soft tissue sarcoma, and the second one is sarcoma of bone. We will learn about soft tissue sarcoma in this presentation. Soft tissue sarcoma is the commonest site is in the extremity. They have 45% in our body, and 38% is in intra-abdominal, 10% in trunk, and 5% in head and neck. But the soft tissue sarcoma can occur in any part of our body. Now, about the staging of soft tissue sarcoma. Now, what is the staging? Staging is a system which classifies patients with same prognosis and same extent of disease. This system is very useful for decide the optimal of the treatment. So, the 3 points that very important about the staging. The first of all is classified patient with the same prognosis and same extent of disease. We doing this staging for decide the optimal treatment for the some of disease. Now, what is the difference of staging in soft tissue sarcoma with another tumors? We can see this is the staging of soft tissue sarcoma. They added something different with another tumor. They have a grid staging. You can see not only TNM like another tumor, but they have grid staging in soft tissue sarcoma. In soft tissue sarcoma itself, there is some grading that we know. There is a grading system based on NCI, grading system based on MSKCC, and grading system on FNCLCC. But grading system based on FNCLCC is the most used in the world. NCCN and IGCC use this base grading. This grading is count from the tumor differentiation, metastatic count, and tumor necrosis. From the three of this one, we grading from the low grade, intermediate grade, and high grade. So, is there any difference in staging in soft tissue sarcoma with different location? In soft tissue sarcoma, staging is not only based on the soft tissue sarcoma itself, but it's based on the location too. This is the example of soft tissue sarcoma in head and neck. And this is the staging system in soft tissue sarcoma in trunk and extremities. And this is the staging system of soft tissue sarcoma in abdomen and thoracic visceral organ. And this is the soft tissue sarcoma staging based on at the location at retrobanding. We can see that with the different location of the body, so the staging system is different too. So we must be careful for if we want to staging the soft tissue sarcoma. We must see the first of all is the location of the soft tissue sarcoma first. Now, how about staging of soft tissue sarcoma in AGCC 7 and AGCC 8? There's a difference too in staging of soft tissue sarcoma in AGCC 7 and AGCC 8. We can see that AGCC7 and in the right is AGCC8. In AGCC7, uh, the T is still used the dip of the tumor, but in AGCC8, the dip of tumor is not used again. And the lymph node metastasis in AGCC7 is classified in stage 3, but in AGCC8, the lymph node metastasis is classified as a stage 4. So we must be careful too in differentiated use AGCC7 on AGCC8 in soft tissue sarcoma system. Prognostic factor is variable that estimate the risk of an outcome of interest of at specific time. Prognostic factor affecting the disease-specific survival, local recurrence, and metastasis recurrence in soft tissue sarcoma. In soft tissue sarcoma, prognostic factor can be differentiated in 3 different kinds. First of all is patient-related factor, tumor-related factor, and treatment-related factor. The first one, patient-related factor, is age. Age in soft tissue sarcoma have a prognostic value. From some literature, men or women that have soft tissue sarcoma with age above 65 can have a prognosis is more bad than men with or women with soft tissue sarcoma with age below 65. The second is duration of symptom. Men or women with soft tissue sarcoma with duration of symptom that more longer than people with soft tissue sarcoma with a short-term disease will have a bad prognosis factor in soft tissue sarcoma. The second is tumor-related factor. In tumor-related factor, there is an anatomy location, depth, subtype histology, size, grade, and compartmentalization. In soft tissue sarcoma, anatomical location is have the prognosis value. We can see that in intra-abdominal soft tissue sarcoma have a more bad prognosis than in another place in our body part, like maybe in extremitas and another part. The depth of soft tissue sarcoma is very bad. Is very bad prognosis factor too. More depth the soft tissue sarcoma, more bad too the prognosis. Some subtype histology has a very prognosis factor too, and the size more bigger the tumor, more bad too the prognosis factor. The grade too, we can see the grading system before. The grade more the high grade is have a bad prognosis factor than the low grade. And the other is compartmentalization. The treatment relative factor. First of all is surgical margin. If the surgical margin of soft tissue sarcoma is not obtained, and there is some positive margin, there will be a more bad prognosis than if we can obtain the safety margin of the soft tissue sarcoma. And type of surgery. If we use, in some literature, if we use amputation, we will get more lower local recurrence than if we use only wet excision in soft tissue sarcoma. Okay, thank you. I hope this video can be very helpful.